discuss the 8 problems and solutions for ICD-10. My name is Brendan Flanagan. I work with HealthCell as a revenue cycle management company providing on-demand revenue cycle services for physician practices and hospitals nationwide. Before I begin, just a couple items. We will be recording today's webinar. So at the end of the webinar, we will be sending you a link to the recorded version. There's a lot of information that we're going to cover here. So relax and take as much as possible in, and Lisa will answer a couple questions at the end, but then we'll be following up to if there are any other questions that you might have. So, well, let me introduce Lisa. Lisa has been a registered nurse for 20 years. She's a trained ICD-10 transition specialist, has been in the compliance arena for over 10 years. She is an OSHA specialist, certified HIPAA professional, and certified identity theft risk management specialist. She is a national trainer, speaker, and training in over 47 states and over 500 cities. She has personally trained over 50,000 healthcare professionals in various areas of compliance and is a member of the National Speakers Association. She has worked with many local, state, and national medical societies and associations and is recognized as an ICD-10 expert in some of the most prestigious facilities across the nation. She's also a published author in many healthcare magazines and was recently featured in Becker's Hospital Review. So, Lisa, turning the mic over to you. We're happy to have you, and thanks for your time today.
Thank you so much, Brendan. I'm excited to partner with you guys, and really, you know, what everybody's looking for right now is solutions, because we all know there's enough problems in healthcare, and so I am happy to partner with HealthCell and happy to be a part of such a great growing organization. And you know, I'm excited to share with you guys too, and one of the things you'll find out right away when I start talking, I'm Southern and I'm a fast talker. You know, I do these seminars anywhere from 45 minutes up to 3 hours, so I have learned to put a lot of information in a short amount of time, and that's what I'm going to do for you guys today. And you know, I really pride myself on being able to give you the right amount of information, concise and to the point, so that when you get off this webinar, you actually not only know what to do, you have resources to go do it. And I think that's very important, and we're finding more and more that, you know, people want to do all these webinars, but nobody wants to be sold anything. But at the end of the day, people do need solutions, and I certainly want to give you guys and have enough time in the presentation today. So I'm probably not going to take the whole hour, so you can relax and know that this is going to be very fast-paced. And again, I talk very fast, but I think that you'll enjoy it, and I certainly think you're going to get some good information that will certainly help you as you move along in your transition with ICD-10. And Brendan, my screen is a little stuck here. But there we go. I made it work. So first thing, let me tell you, when I do webinars or seminars in person, I do a lot of them, as you guys heard. I've trained probably maybe now over 50,000 healthcare providers and staff, and in hospitals, through webinars, seminars, on-site presentations. I do a lot of education, and I really have a passion for sharing, and I have a passion for helping you be successful. But today's webinar really is to share the problems and the concerns or the challenges, and I really shouldn't use the word problems. I should use the word challenge, and then also the solutions, because you basically, and I don't know where you guys are, but if you're like most of the country, you are probably not where you need to be. I mean, 95% of healthcare right now is not where they need to be in relation to preparing and getting ready or in their implementation for ICD-10. So my job is to give you some good solutions to help you get started. And really, you know, this is not a scare tactic for me. I don't really want to scare you and do the sky is falling routine. I want to say we don't really know what's going to happen on October 1st, 2014. The best we know today, it's not going to be delayed. It is going to move forward. There's not going to be any leniency granted as far as we know today. The payers aren't going to cut you any slack as far as we know today. So this is real. And again, if you're like most organizations, you're behind. But a lot of the times it's just because you simply didn't know what to do or where to do it or how to do it. And so that's really what today is going to be about over the next few minutes. So I want to first kind of give you a little bit of background about ICD-10 and talk about, just very briefly that, the U.S. is really one of the last countries in the world not to adopt ICD-10. 151 other countries have already adopted ICD-10, and many have done it very successfully. Canada is an exception in that they're still struggling 10 years later and never really have bounced back from the loss of productivity, and I will talk more about that as we move on, but it really is time for the U.S. to adopt ICD-10, and one of the problems that we have is that many providers don't understand the benefits of ICD-10. They only see the problems of ICD-9. And when you look at the timeline for ICD-10, those providers and having that kind of attitude, and sometimes they're just not educated properly. They've been confused by the delays, by the AMA puts out information, the American Medical Association, that is, and the Medical Managers Group Association, the MGMA, and they're all great, fine organizations, but when they put out these these emails and these articles begging CMS to delay implementation, it's just confusing. And so what happens is a confused mind does nothing. So people have put it off and put it off. And when you guys look at the timeline, you can see that really you should have had your team together, your project manager together, a project plan together, put a budget in place. You should have done that in January and February a year ago in 2013, and 90% of the clients that I personally work with, this is what I'm helping them do, and here it is February of 2014, so they really are a year behind, and that's okay if you are. You can certainly catch up, and this webinar today is going to do just that for you. It's really going to help you condense the timeline and catch up to be where you need to be. The number one problem or challenge is just what I was saying. Organizations are very far behind in the process. There's been a lot of confusion, again, from all these organizations asking to delay it. We know that it's going to cost a lot of money. A new study just came out that says it may cost you as much as 3 times what we initially thought that it was going to cost you. And there'll be many people that will listen to this webinar, whether it's live or in the playback, they'll say, man, I have no idea. I talk to doctors every single day, and they all do the same thing with like a deer in the headlight look of, Lisa, I had no idea that it was going to cost my 5-provider practice $70,000 or $80,000. This new study is saying that it might cost 2 to 3 times that. And guys, 50% of that cost is going to be in extra staffing, loss of productivity, seeing fewer patients because of confusion after October 1st, and that's where some of those numbers come from. But the bottom line is people are far behind. So what's the solution to do that? And the solution is just like everything, and we make this joke about how do you eat an elephant, and the answer to that is 1 bite at a time. And guys, this is the biggest change in healthcare in over 30 years. This is truly an elephant. And the best way to do it and solve that solution or that problem of we haven't started, what do we do, and we're panicking, is get a project manager. Whether it's your office manager that you're going to ask to do that, or you're the office manager or practice manager and you're on this call today or this webinar, if you have to be the person in charge, then so be it. I know in our program that we put together, we actually put a form in there where your provider or your CEO at your practice or small hospital, whichever is on the webinar today, would actually appoint you as the project manager. Somebody has to look at this as a project and has to be in charge of it, and that's going to include putting a team together. Even if you're a small practice with only a couple of providers, and you can have a receptionist help you, or maybe a medical assistant, maybe somebody in coding. Even if you can just have somebody help you just a little bit and give you an hour or 2 a week over the next 10 weeks, that would be very helpful to you. And I'll talk to you a little bit about what the team should look like. And I always say, and here we are, HealthCell is sponsoring this webinar today, but if you have ever thought about outsourcing to a revenue cycle management company, now is the time that you want to connect with somebody like HealthCell and be able to do that, because that's going to shave some of the work off of you. The one thing I do want to make clear is that your EMR company and your billing company and your clearinghouse, they cannot do this transition for you. They can do their role. They can do their part. There may be some costs involved in that. They may be putting you off a little bit. That's one of the big challenges or problems, is talking to those vendors and those payers and getting your questions answered. But you can't do that if you haven't made yourself a project manager or designated one, and then put together a project team. And that's going to require a couple of hours a week and maybe even some weekly meetings. What does managing a project look like? Well, here it goes. You know, it's going to take you a couple of hundred hours to do this work. And if you can divide that up, especially, it's so important for me to drive home the fact today that some of this stuff should have been done 6, 8, 10 months ago. Well, you don't have that much time now. So now you're down to, we've got to really condense all this stuff and get it done. And how do we do that, right? We designate that practice manager or that project manager, and then we say, you know, can Sally, Jim, and Beth help us just for a couple of hours a week? And then if you start investing a few hours a week in some of these things I've listed here, somebody you may assign contacting the vendors. I know in our program we put a page of that in, of team assignments, and we spell it out for you. Somebody's going to contact the vendors. Somebody's going to contact the payers. Somebody's going to help put a training plan together and look for resources, and maybe there are free resources, and maybe there's less expensive resources we can shave. Somebody has to do an impact assessment. And guys, there's no time left for an outside formal impact assessment unless you are a hospital or unless you are a practice with 30-plus providers. If you're a practice with 30-plus providers, you need a resource to do, even if it's a remote impact assessment and give you a budget and establish a timeline for you. If you need somebody remotely to do that, you have to jump on it. Resources are drying up. There are very few ICD-10 project managers out there. There are very few companies who will manage it remotely for you and do a good job that you can trust. And so it's important for you to look for those resources. And, you know, maybe that's a person's team assignment. It's just finding that. But that impact assessment is huge to helping you be successful with ICD-10, because you can't do the next step, which is putting together a budget, until you've completed an impact assessment, because you won't know what the impact is to present to your providers or your CEO to get buy-in. And I'm going to talk about that. That's a really big challenge. Then a communication plan. You know, are we going to have weekly meetings, bi-monthly meetings? You know, are we going to meet on Mondays at 9 o'clock, and who's expected to be there? And, you know, let me assign you some tasks, and I've got to create a timeline for that, and we'll have milestones, and I'll hold you accountable. And, you know, I'm not trying to make it sound difficult, because really this is not difficult. What it is a lot of little steps. And the mistake that you make is thinking, I can just send my people to a coding class, or I can find out, you know, from a CDI specialist what my doctor needs to document, and I'm good. If you do that, guys, you'll fail and you won't get paid. That's the bottom line. They say as many as 10 to 15% of private practices are going to close their doors over ICD-10. And let me tell you, I was just talking to a top-notch company today that says, you know, even our clients are having a hard time seeing this as change management. They're having a hard time understanding we can't just send Sally to a coding class and tell Dr. Smith what to write. You know, there's going to come a really big resurgence of fraud and abuse and lack of medical necessity and other types of potential audits because of ICD-10. It is so crucial for you to get every single step right, from the crosswalk to the mapping to the, you know, the training, making sure that they're trained properly, making sure that that budget is there, making sure that after October 1st, you have money in the bank. The one thing that every expert in every company that I've talked to, and boy, I'm worn out from talking about ICD-10 for the past 12 months, they all agree on one thing. The financial impact before is significant, and the financial impact after October 1st, 2014 has even more potential to even be more significant. So everybody knows you need a war chest and you need money. All of these things, that practice manager or that person that you're going to designate to be the project manager, this is what they're supposed to be doing. And when you wonder, like, excuse me, when people say, why is it going to take so much time, or what is it going to cost money? Your practice manager managing this project can't do her job. These coders, when they have this loss of productivity and they're learning, somebody needs to do their job. There's going to be a backlog of 9 denials and 10 denials. Who's going to handle that? Will you need extra staffing? There's all kinds of things to consider here. Moving on to problem number 2, still, providers don't think that it's going to cost money, and they're not willing to make the change in documentation. We deal with hospitals every day that they're on the implementation side. Their IT team is doing pretty good. They've got their training. They've got their budget. They're rolling along pretty well. But as it turns out, the providers just will not get engaged. That's a huge problem. For the solution of problem number 2, let's focus on the benefits of ICD-10. Let's present providers with the facts. Hospitals may consider using an outside source for provider engagement, and may even work with a physician liaison. We do a lot of that in working with physician liaisons to do on-site seminars just to come on and cheerlead the doctors in hospitals. And that outside resource is very helpful. You guys you maybe look for your own outside resources to cheer your own providers on in your private practice, but you're going to have to do it. One of the things about engaging your providers is sharing the benefits. Presenting the facts from other countries, I find that very helpful. When they understand that 151 other countries have already transitioned and that many of those experienced faster reimbursement, fewer denied claims, higher reimbursement based on acuity because they actually could talk about how sick the patients were. All of these things are benefits that providers need to know. Hospitals need a peer-to-peer champion. Even in private practice many times, it helps if you have 15 or 20 providers and you have one provider that can understand the benefits of ICD-10. We have an ICD-10 champion that we use to help in some of our practices because that person understands the power of ICD-10. And sometimes doctors want to talk to other doctors, so that really helps them. Showing them a real budget, getting them to understand that 50% of your budget is going to be in lost productivity. So when you tell them it's going to cost $50,000 for a 3-provider practice or a 4-provider practice, you need to break that down and help them understand that. Educating them so they see the whole impact, so they are not in the dark and think they can just send somebody to a coding class. And then, of course, one of the main top things that you can do immediately starting today before you even do an impact assessment or put together a budget is show them examples of documentation. If you can take and convert their top codes, and I know we have most all specialties already converted for our clients and are now adding the clinical documentation improvements to that for CM, if you will, or outpatient, which is what ICD-10 CM is for, ambulatory care. PCS is for inpatient. But if you can show them some of those documentation changes and actually share some of the guideline changes with them, and I'll give you an example. In cardiology now, under ICD-10, an acute myocardial infarction is 8 weeks, or what is 8 weeks in ICD-9. For ICD-10, acute would be less than 4 weeks, or 4 weeks or less. So we need to get them documenting the date of the myocardial infarction, not instead of last month or a couple of months ago, which is how they typically document now because they've had up to 8 weeks to worry about that. So that's just a coding guideline change that knowing those kind of things helps them get into, you know, and buy in and engage and go, okay, well, that's not that big of a deal. You know, if your doctor does their own coding, showing them the 9 code, what the 10 code looks like, some of those elements that maybe, especially if it's orthopedics, that they've been leaving out. And they didn't have to know, was it a soccer ball, was it a football, was it after school, did a kid fall on you, did you fall on the kid? All of those are things that doctors may not be documenting now, But those are the kind of things that you need to share with your providers to engage them. They don't need to know the whole detail. They don't need to be in every single meeting. They need to see the budget. They need to sign off on the budget. They need to understand where your hours are coming from, and if you need overtime or if you need additional resources and some of your people may work overtime or some of your team. Those are the kind of things the providers need to know, and that's how you get them engaged. Here are those benefits I keep talking about. ICD-9 is broken. It's 30 years old. It has so many problems with streamlined payments and denied claims or pending claims because of lack of medical necessity issues, because of not being able to prove it or document it and not being very specific. ICD-10 has all of that. Everything that 9 has that's broken, ICD-10 can fix. Guys, there's two ways to look at the changes in healthcare. And Brenda and I were just talking about all the changes in healthcare, and some of it is wonderful, and some of it is a headache, and some of us just want to quit and never even say the word healthcare again. But the truth is, it's also opportunity for growth, and it's also an opportunity for you to say, we treat patients who are sicker with asthma, and now because ICD-10 and that greater specificity and having to document it, we can actually go to our payers and use these provider contracts and say, hey, we treat sicker patients. This kid always needs 2 breathing treatments when he comes in, so therefore we deserve higher reimbursement. You know, there is no one-to-one mapping with 9 to 10. You know, a lot of other things, even the DRGs and all of those things can potentially be impacted by ICD-10. But this is your chance with insurance companies to be able to say, we need to see them longer. They need more treatments. They need, you know, longer time or a longer treatment time, longer patient visits. I mean, all of these are opportunities for better reimbursement. You know, we've had insurance companies, and I say we because really I'm a provider too, as a registered nurse for almost 20 years, but we have had providers beat us up for many years, or payers, sorry. Providers beat us up too sometimes, but payers beat us up for many years, you know, because of lack of medical necessity, or, you know, we're going to pin that claim. We need more information. You know, we don't know that this patient's really sick, or all those tests were really necessary. This is our best opportunity ever in a million years to actually prove it, and that is a great benefit of ICD-10. Let me talk just a minute. You know, I have had an ICD-10 boot camp. I did enjoy it very much. I'm just learning, but I'm not a certified coder. And I just want to show you kind of a snapshot of what the specificity looks like. You know, we're now going up to 7 characters, and these numbers aren't correct anymore. We're going from about 18 or 19,000 codes to all the way up to 170,000, but that's when you include outpatient, which is ICD-10 CM, and inpatient, which is ICD-10 PCS. So that's combining those. In private practice, you're going up to about 69,000 total. So, you know, and by the way, you don't use all 20,000 now or 18,000. You're not going to use all 69,000. So it's not the number that counts. It's really that specificity, and most of you already know it. You already document it. 60% of the time you're doing a great job documenting, and nothing has to change. 40% of the time there are going to be some changes and elements missing. So don't be so overwhelmed by that piece of it that you kind of, as we say in the South, throw out the baby with the bathwater. You can work on that. So other things about ICD-10 and ICD-9, this is an example of Linda who has a fractured wrist. In 9, we see that that is one code, and it would be kicked back because they're going to need additional documentation. In 10, here you see it has all these different options because it's so specific. It says which bone, which hand, which encounter, what type of fraction, what type of healing. All of that's important to get paid in ICD-10 and get paid the correct amount. Here's an example of diabetes mellitus. For ICD-9, there's about 40 codes. In ICD-10, there's 318. But again, we get those underlying conditions, and those are built into the code. So that's why you see there's so many more codes there. Problem number 3, we don't know how to get started. Boy, that's really an issue with everybody. The way to get started is, like I said, is start with that impact assessment. You know, once you've got your project manager, you do an impact assessment. You make a list of everything in your practice from the front door to the back. Again, this doesn't have to be a formal thing you spend thousands of dollars on. It can be a pen and a paper, and you're looking at your workflow processes. You're looking at any paper forms that need data conversion. You're looking at where it's affected in the different areas of your practice. Is it the clinical staff? How are they affected? What about documentation? What about my third-party payers, billing companies, clearinghouses, training? What type of software do we need? When it need to be upgraded? What about our templates? What about our pick list? All of those things. What about our internal office processes? Any paper forms we have? Even computer forms. You know, now when a child comes in and they have asthma, you know, it's going to be required to say, is there a smoker in the home? So some of those forms, even in your computer, those are things you need to talk to your practice management software company about, or your EMR company. All of those things have to be addressed. Scheduling, when it comes to scheduling patients ahead of time, knowing the codes ahead of time, making sure you have it right, converting your super bills, lab, referrals, PT, OT, DME, all of those things have to be addressed. I mean, and there's nobody to do that. That's why I say, you know, one of the biggest myths about ICD-10 is our EMR company is going to handle it. And we work with a lot of revenue cycle management companies, and they get calls every day from the patient or from their clients saying, their providers saying, well, aren't you guys going to do this for us? But these are all things, guys, that are examples of things those companies can't do for you. The great thing about going with the revenue cycle management company is that they track your claims. They track your payers. They track your productivity. They track where there's problems now in 2000 and ICD-9, so they're going to know what the problems are after October 1st and where the challenges are. Most small private practice doctors don't do that, and it's costing them up to hundreds of thousands of dollars a year. That is a benefit of you outsourcing to a revenue cycle management company. But again, they can't come in your office and do all these steps for you. Problem number 4 is going to be the cost. These are things that I was talking about when you put together a budget, all these different areas you need to consider. Any software upgrades, education, whether it's, you know, we're starting to do a lot of on-site education where they call us up and say, you know, we have 14 OBGYNs or 6 OBGYNs. Will you come and train in a one-day session all of our OBGYNs and our coders in coding on-site? And we're like, well, sure we will. You know, what they're finding out very quickly is, yeah, doctors don't like seminars, and doctors don't have a really long attention span, nor do they have the time to do that. But the other thing that we also know is that they also like live engagement. They also do like, so they can ask a question if they have a concern about a specific code or a specific documentation element. So sometimes they do like on-staff training, but that's just one example of where it's going to cost you money. Reprinting of paper forms, consulting services. I mean, 90% of the patients, or the clients, sorry, I've been a nurse for way too long, 90% of the providers and the clients that we work with every day are going to need some outside resources. That practice manager does not have the time nor the internal resources, even though she has the brain power to do it. She just doesn't have the time or the internal resources to do or manage a transition. So there's going to be a cost in that. You may find somebody to manage your whole transition, and you may not have $100,000 over the next 8 months to do that. So you may find somebody that would do it remotely. And again, if you're thinking of doing that, that might be a great option for you, but you better find them quick, because there's not enough partners as far as vendors in healthcare right now that can help you manage for the demand that's going to happen over the next 60 to 90 days. It's just going to be a massive thing. But all of these things are of cost issues when it comes to budgeting. You know, you do need to allocate transition costs for multiple years. You know, you need to consider that people may need to be retrained. I mean, there's a lot of talk even about anatomy and physiology or anatomy and terminology training. So all of those things are potential issues that you need to look at as far as cost. This is an example of a budget, and As you can see here, it divides it out. This actually came from the RAND survey, but I will tell you guys that the American Medical Association, the American Hospital Association, the MGMA, the Medical Manager Group Association, they all have come up with the same budget, and they're all within a few $1,000s. The bottom line, which is best for me to tell you how to tell your providers if you're trying to get them engaged and buy-in on this whole thing, is it's going to cost between $10,000 and $20,000 per provider. And everybody agrees with those numbers. But these is just some examples. And guys, this is from the RAND, R-A-N-D survey. That survey's online, and it's 20-something pages. You certainly can download that and look through it and come up with your own conclusion. Number 5 is training. I don't really think this is a problem. I think the problem has been that so many people tried to train too early. Really, you need to train your staff whenever your vendors are ready to start dual coding and or parallel coding. Whenever your vendors are ready to start that process of internal testing, to me, that's probably when you should get your training done. The only exception is that is on those top codes where you want to convert those top codes that your providers use. Make your providers flashcards, include some of the documentation elements just for education purposes to get them going in the process. HEMA, has their own saying about who should be trained and how long. So does the AAPC. They have a lot of different things about how they should be trained. We say that probably in March is good enough for you to start training your staff. But you need to think about that. Who needs to be trained? How much training? What's the cost? Are we going to do it on site? Are we going to send them to a boot camp? Can we do it online? What's the most effective? Remember here, it's not always the most cost effective. It's the most effective because this is your money. So you probably can find some very expensive training somewhere. I know in our program, we even give you generic coding training. Now, that's just part of our program that we have. But, when it comes to specialty, you're going to want specialty training as well. So, again, this doesn't matter if this is cost effective. It just needs to be effective. Problem or challenge number 6 is contacting the vendors and payers. It's pretty easy to pick up the phone and call them, but it's not always easy to get answers. And you know how I know? Because we work with EMR companies, we work with billing companies, we do not work with payers, but we work with those companies and train and educate their clients. And I know that they're getting a lot of calls, and they're calling me, and they're calling us, asking us questions as well. Guys, we are all in the same boat here. I could be considered to be one of the top speakers on ICD-10 in the country, but do I know everything? Do I know really what's going to happen on October 1st? Can I assure you that all your payers are going to be ready? Can I assure you that when you start submitting that data that it's all going to work with the 50-10 transition or conversion and it's all going to work? We have no way of knowing. And that's why it's so important for you to get the answers that you need. There's about 15 to 20 questions you should be asking your vendors and payers and your billing companies like HealthCell or revenue cycle management companies. You need to start asking those questions today. You need that information because that information is going to help you build your timeline and build your budget and figure out about testing and figure out, what the cost for or if there's cost for upgrades. Some small payers may sunset. They may go out of business. Some vendors may not make the transition. Small companies that do free EMR, some of those companies may not be able to make the transition to ICD-10. It costs a lot of money. Again, you're talking about $10,000 to $20,000 per provider if you're a small practice. So imagine if you're a small payer, you're still going to have the same type of transition. It's still going to cost them an X number for each provider or each person that submits a claim to them. So they are going to have money issues too in the end. So solution number 6 to that, as far as that challenge, make a list of your vendors and payers. Demand answers to your questions. Document everything. I need 10 exclamation points after that. So talk to your vendor reps, right? And then when you're talking to them and you say, well, I talked to Sally on this date, and they're going to give me an answer on this date, and this is the day they're going to have the upgrades ready, and this is how much it's going to cost, and you have to stay on it. Again, this is almost a full-time job depending on how big your practice is and how many vendors and payers you have for that team member to do, because this is a lot of work. And listen, let me say this too about that. As time goes on, it's going to get to be more work because the hold times are longer. More and more the payers and the vendors will start posting on their websites, this is the day we're going to have the upgrades ready, this is how we're going to handle it. But for today, they don't have all the answers yet. So, I mean, this really is, it's very concerning for healthcare in general. Issue or problem number 7 is understanding that everything is affected and all of these internal processes need to be tested. They need to be upgraded. You're going to have to split claims if you do things like PT or OT or write home health prescription treatment plans. You're going to have to split those claims because it's going to go by the date of service. And so there'll be a 9 claim, and then there'll be a 10 claim, or ICD-9, ICD-10, dual coding. Auto insurance workers' comp, disability, they don't have to convert to ICD-10 because they're not covered under HIPAA. So who knows how long you'll have to dual code. You should be doing dual coding or parallel coding already just for testing purposes with your vendors, just to see how the systems work. And that's for practice, of course, because you can't really submit a claim for ICD-10 until October 1st. But all of those are just things that need to be addressed. Somebody in your practice or on your team has to take control of that. Some of those solutions, using the impact assessment, getting the payer list, making those calls, get firm answers from your vendors about forms, upgrades, and calls, making notes, and again, having a team member do that. That's how you solve that big problem. Then the last challenge and concern, and I don't think that we've probably talked about this enough in healthcare, and we're starting to really get it because of all of these reports that we're finding out, that you're going to have some cash decrease past October 1st, 2014. So not only are you putting money and time and energy into getting it right over the next 7 or 8 months, but after October 1st, there's going to be a 40% decrease in coder productivity because of learning curves and errors. There's going to be backlogs of claims. There's also going to be, edits not working properly potentially, or some other type of issue with submitting claims. The potential reimbursement impact, I mean, that's why they're all begging all the payers to give you a grace period. And so far, they're saying it'll shut down healthcare if we give you a grace period. You need to do this right thing on your end and get it right. Now, in the end, do I think you might get some kind of leniency? I sure hope so. I sure hope you do, but you have to expect the denials and the underpayment, and you have to plan for that. Every country that has transitioned to ICD-10 have all said the same thing. You need a war chest. You need 6 months of operational cash. And I hope that HealthCell don't mind, but just, a plug for revenue cycle and transitioning or partnering with a great revenue cycle company is you can cut that number in half, down to maybe 2 to 3 months of operational cash in dealing with a company that does it every day and tracks it and has more resources than you have in the private practice. That being said, I said a lot in 38 minutes, and Brendan, I want to be able to take some questions, and so I'll turn it back over to you.
Absolutely. Thank you so much, Lisa. You're right. That is a lot of information, and it's really a big project and a lot. As a revenue cycle management company, we certainly understand, and we hope that the practices are well aware of some of these changes. One question that came to my mind is, I know you work with practices on a daily basis, and you have a boot camp, a training program guide. If you're sitting in the shoes of a practice manager and you already have multiple hats and you have a budget constraint to work within, what type of resources are out there that you might be able to offer to help these practices?
Well, I will tell you, and I always say this, there are a lot of free resources on AAPC websites, AHIMA. CMS has a 60-page guide for practices of various sizes. I will tell you that, and my clients have said this, without question, that they found those difficult to go through, and they didn't feel like that the language was written in a way that they would understand, which is why I tried to do the way I wrote our program. I tried to make it simple and systematic and step by step. I mean, there are critical access hospitals that have our guide and our system because, it's that simply spelled out. And I think that's the challenge with the free resources. But all of those websites have free resources. I mean, there are impact assessments on there. There are other tools there that can help you. There are, of course, conversion tools for converting those codes. We have the top specialties for our clients converted as well. If you want specifically about our program is $749, and that's per practice, not per provider, and it includes a 45-page guide. It's now 46 because we keep adding to it, but it's very step-by-step. It's very systematic. I wrote it so simply that a brand new practice manager that has never managed a practice before could go through this guide and do step 1, step 2. There's recorded audios on there for providers, for staff, for the project manager. There's forms for the budget and the template. I mean, there's all kinds of things on there, and we do weekly webinars, question and answer, unlimited email consulting. So we do a lot for that, and I don't usually talk about that, but since you asked me, I'll mention it. But it's a great program.
Perfect.
Are there other questions?
If you have a question, there is I'm sorry, I did not mention this earlier. There is a question box. I see one question is, can we get a copy of the slides? Yes, absolutely. We will be sending out a copy of this presentation for your reference. We will also be hosting this session on our website at healthcell.com. Okay. All right. Well, happy to answer any questions. You feel free to call us afterwards. But before we conclude the session, just want to introduce HealthCell as well as a special promotion we have with Lisa to help get the expertise of Lisa in the hands of some of the practices out there that are looking for solutions. Just quickly, HealthCell, we provide a on-demand tailored RCM service for physician practices as well as hospital organizations. We collaborate with in-house billing departments as well as handling end-to-end revenue cycle services, AR cleanup projects and analysis, and in some cases even type of overflow support. And relative to ICD-10 and some of the things that Lisa said about productivity and increases in denials and complexity relative to ICD-10, HealthCell, we are aligning with in-house billing teams as well as any practice that is little concerned about some of those changes that happen on October 1st. We will be ready. We will be aligned with those teams to provide some overflow supports. What we at HealthCell, we have a pro-flexibility promise. It's unique about our company. We believe that a fundamental part of running a small business or any small practice is the ability to stay nimble. It's a distinct advantage that many practices have over larger competition as well as competition relative to regulation changes. So as part of our services, we are actually utilizing your infrastructure, your existing software platform. We are not taking any type of data out of your office. It's your service team. In effect, you are building a billing department or additional support to your existing billing department by utilizing HealthCell services. You retain an exclusive team to support your office and whatever your needs are. We also work within your service terms, whether it be an ongoing monthly basis or it's a project base, such as an AR cleanup or ICD-10 comes down the road. Now, relative to our promotion, Lisa just outlined what type of training guide that she offers through TrainRx. Between now and the end of March, we will be offering TrainRx as a complimentary guide, as a complimentary service, really, for anyone who hires HealthCell services between now and the end of March.
And Brendan, can you also tell them that they can get in touch with me directly if they'd like, and I'll certainly refer them back to you guys. They can go to our website at trainrx.net. Make sure it's not .com, but trainrx.net, and they can reach us there. And we're happy to work with you guys. I mean, I had a group of pediatricians tell me last week in Ohio, by the way, we work with virtually every pediatric group in the state of Ohio, and they said, we think that your guide probably saved us $10,000 in time and effort and energy. So, I mean, I'm proud of that. That makes me proud. But happy to work with you guys and happy to be a part of what you guys are doing. And I appreciate you so much for having me today.
Yeah, thank you, Lisa. That's a really good point. And included with the this information that we'll be sending out, Lisa's contact information as well as a link to her company's website will be in the information. Okay, everyone, thank you so much for your time. And we look forward to work with you in the future. Thank you.